first and foremost, not everyone even just has the trained interpreter to start, right? They're utilizing family. What are maybe the other top two, most important out of this, a complete catalog of things that are important? What are the other two biggest maybe changes that enable this access?
Well, one of the things that is very concerning is that, there's the spoken word and then there's the written translation, right? So interpreters interpret the spoken word or sign, and then translators might do the translation from one language to another document wise. A lot of people think that, oh my, why can't I just use Google Translate or some sort of app to help translate? Well, usually it's only one direction, right? The communication. And it's actually against the law because it's created so many issues. It doesn't have the sophistication yet. Now, mind you, AI is changing rapidly before us. So perhaps in another 2 or 3 years, it will be a lot better. But it doesn't have the sophistication to do medical. Some examples are, somebody's cardiac arrested and it came out as your wife's heart was imprisoned.
Mhm.
Okay. There's lots and lots of mistakes that happen. And if you think about it, this is life or death situations. You don't want to miss anything that could be of such a negative impact to that patient. So you really are not, you're prohibited from using Google Translate. And many people do not know that. And many people, even though they may know it, think that it's benign and it's just people being super, super cautious. No, there's real reason for that. And the translation, sometimes they'll use machine translation, and that's also prohibited by law. You have to have a qualified translator. So let me rephrase that. It's not prohibited that you can use machine translation to translate medical documents. It's not allowed to be presented to the patient unless a qualified translator reviews it, a human. So let's say that you did this Google translation or whatever. Uh, a medical translator who's qualified and does pretty much only that has to review the document for accuracy before it can be presented to the patient or the public. And this
That makes sense.
originated yeah, but in I think it was Virginia or the Carolinas during COVID when they used machine translation, and it actually came out on the website that says you do not need to get vaccinated. So, this it was detrimental to the Hispanic community because they were reading, you do not need to get vaccinated. So that was done
Mhm.
with machine translation. So I would say those two things are extremely important. And then the third component, right? Myself being a bilingual clinician, being a Portuguese speaking nurse, you know, um, is that you have to now make sure that you test your bilingual clinical staff as part of Section 1557. So by that, I mean, let's say you have three Arabic speaking physicians. They've been speaking to the Arabic speaking patients all along. Well, you now have to make sure that you have vetted that they're clinically fluent to do so. And the law leaves it up to the entity on how they're going to do it. So in my case, when I started this as the Section 1557 coordinator in 2016, we tested over 8,000 providers. And it was extremely difficult because some of these folks, were raised speaking the language. They go to church with their grandmothers in that language, and yet they did not pass this assessment. So they felt eviscerated. They felt like I was taking away their cultural identity. And in essence, they are fluent in speaking, like conversationally, right? They're fluent, but they're not fluent with the clinical terminology. And they really need to be fluent with the clinical terminology. I'll give you an example of a patient, diabetic. There's a test that they do that's called the A1C. It kind of determines how they're doing with the diabetes. Well, if I was to explain to a patient in English about A1C and diabetes, probably take me a good 5, 10 minutes. If I was to do it in let's say Spanish, and I was fluent in it, but I didn't know all the medical terms. It basically gets rendered like you have too much sugar in your blood. You got to stay away from sugar. That's not the same level of care that the English speaker got. And you have to always provide the same level of care to all patients. regardless of
Right.
race, national origin, disability, age, or any of the other factors. So to
Mhm.
me, this is a very good thing because out of the 8,000 that we tested, 40% of them did not pass. And this was a pretty reasonably easy assessment. It wasn't that difficult. It was difficult enough that I could sleep at night knowing that we did something and I validated their clinical fluency. But 40%, 4 out of 10 did not pass. And some of the errors that they made were egregious. It was like, one was we're gonna remove your kidney. And it was like for knee. Kidney, knee. I mean, I don't even know how to do that. I mean, it's just some of the mistakes were really, really bad. Though some of them who failed actually said when they saw the results, okay, I see that now. Others were still really upset and angry that we were not going to allow them to continue to use their language under the scope of their license and their clinical practice to care for those patients, right? Um, it would be great if we could have every physician open up their mouth and speak directly to the patient in their language. It would be my dream, or a nurse, but it's not going to happen. It doesn't happen now because we just don't have that kind of distribution geographically of nurses and doctors. They don't even exist, frankly, that speak other languages to the level that we should have, right? So it's to
Right.
me, it's like if they can do that, then they're putting their hospital system in a much better position to succeed. So let's say I pass this assessment, right? Think about this, Carrie. I'm at the bedside, I'm a nurse, and you're Portuguese speaking. I can take care of you without the involvement of an interpreter. I can care for you myself by just speaking to you, doing my nursing just in a different language.